the effect of it. So what's the effect mobilization, just to revise?
Right, further relaxation.
So
Stretch.
relaxation, stretch,
Send
of
the message.
muscles.
Send the message to the brain.
Send a message to the brain and work into a relaxation pattern. Yeah? Good. So let's start with now seeing what kind of movement we can stretch. Okay? So the most obvious one is rotation. So again, do not lift the head from the neck. I see a lot on YouTube videos, people just doing that, and I see the sternocleidomastoid, and I see that it's, and then even moving like that, and then they say, and stretch. Yeah. Well, it's not going to be stretched because the person is going to hold from uncertainty. So do not do that, and just really roll the head. Now, when I'm rolling the head, I'm looking for two hands holding, so one probably here and one on the other side, and they both work together. So actually, do I roll the head with my hands or with my body?
Your body.
Body.
Yeah, okay. So with the body.
And your left hand's quite high up there, isn't it? Rather than.
Yeah. You can, yes, because I want to move the head. I can do that also on the neck itself. Yeah. Okay, great. Now I've put the head there. Now I can stretch even further by doing it either this way or that way. This way seems to be more comfortable. Now I'm not moving both hands. I'm just moving the lower hand there. Which muscle I'm stretching now?
Trapezius.
Trapezius. Good. Good. How long do you need to hold it? Do you think 2 seconds is enough?
Maybe longer.
Yeah.
Right?
I would say 15. Get the body to get used to the stretch. And again, how do you do the stretch? Are you going to say, stretch? No. You gradually do it. So this is where your attentiveness is very important. Okay. So let's say that I will talk what I'm doing, okay? One hand here, and I'm saying, okay, let's do a bit of a stretch. I'm keep stretching it a little bit more, teeny weeny more. Okay, let's hold it there. Let's try a little bit more. Oh, yeah, it went a little bit more now. That's it. Okay? Now, that's the mistake that a lot of therapists doing. They're saying, okay, I finished it, boom, move the head to the other side. Hey, what's the matter there? You know? Okay, this is part of the treatment of moving between. Yeah? Again, slowly, moving it slow with two hands, even then come to here. One hand on the occipital area. Do you see there is a groove here? This is where the skull end, and this is where the neck here. So you're just holding it here. Be careful from the ear. Sometimes you need to do it over here, sometimes there, like cupping your hands. Yeah? And then again, start slow and build it. You can't force. The body is not a piece of meat. It's really attached to the brain, and the brain all the time monitor what the body does. If I do stretch very quickly, there would be apprehension from the muscles and from the brain, and it will contract the muscle because the muscle doesn't want to have a sprain. It doesn't want to have a tear. So it will contract opposite. So you have to go what I called, you go under the barking dogs. What is the barking dogs? Muscles have sensories of seeing how much it's stretched. If you do something quickly, the body automatically would hold itself. So you need to go under that and to say, relax, I'm going to be here, I'm going to be nice to you. Yeah, okay, I can do a little bit more. Maybe a little bit more. So at the end, you get to what you want, but you can't do it right away. And you stay, and maybe you move a little bit. I mean, that's it, really. And this is like a lullaby song for the nervous system. Good. And then, again, part of the treatment, bring the head back. Okay. Now we're going to do it a little bit different. Instead of side bending, where the nose go down, instead of rotation, we're going to do side bending. Side bending is where we're taking and cradle the head underneath to move it, and then you move your body. So in a way, from here, I know I'm going to the right, I position my body to the right, and then I move it. Okay? In this position, now, you can stretch it this way by having the nose still upward, and then stretch it. Okay? Which muscle do I stretch now? A little bit. Which muscle is on the side of the neck? Scalenes. Scalenes. Absolutely. Yeah? Now, if you're rolling it, you're losing scalenes. I want you to feel. Do you feel the difference, Dominica, between this one and the stretch here?
Oh yeah.
Yeah, okay. It's interesting for you to feel it.
Yeah.
Yeah? Good.
Is it a bit further back?
The scalenes?
Yeah.
No, further to the side, further front. Yeah? I'll show it to you here. This is where upper trapezius is. This is where upper trapezius is, to the occipital.
Yeah.
Scalenes is to the side, right to the side. Before, you don't touch the front of the neck, of the throat. You just touch the lateral side. Yeah? Okay. So, and then you move it again, and then again you position yourself, you're moving it. Yeah? And then one hand here, and the other hand on the shoulder, and you stretch it. Don't let it roll, because if you let it roll, you would feel a different stretch. Okay. If you want, you can add some massage to it by having your hand stayed in here, and then you're massaging the scalenes. This is again, maybe the camera can go around. So again, this would be massaging which muscle? On the back, trapezius and erectospinae. Do you feel that? Erectospinae. And that would be, you're feeling the vertebra on the side. Yeah? It feels hard. It feels like a vertebra. And this is where scalenes are. If I go here, I feel, I've lost the vertebra. I'm into softy area. So the scalenes are very thin. Yeah? Yeah? Good. Okay. Now, next one is traction. Traction is just taking the forces of the head that way. You can do it in two ways, or few ways. You can have two hands underneath, and now you need to find where to put your hands so then you don't lift the head, but you just drag it upward. So again, do you see the small movement? Maybe the camera can come really close to the side. Yeah? And do you see that movement? That's traction. And I'm now coming back to it. That's it. It's not a lot. Another way to do it is having one hand here and one hand on the head. And here, probably with year of experience, you get to see that this is not acceptable. You need to, what they call facelift, right? Take the skin upward, and then again I push it. Here, I kind of clumped between the two hands, so I secure the head, and only then I push it up. So it's actually two motions. One, pushing down, and then pushing towards me. And even then, you can start playing with it, traction and mobilization. But I always keep the pressure upward towards me. Do you understand what I'm saying? Yeah? So it's like a traction and mobilization. Really nice and heavy. So my upper hand press on her forehead down. My right hand on her neck, press it a little bit up. So the head feels secure because there are two forces opposite to each other, securing the head. Then 2 hands, my body push it upward to make her taller, and then I move my leg, kind of side to side. Okay. Last one is flexion, and I'll show you one way you can do that. Is which one I should show? You know, actually, let's stop and practice that. Plenty. Come a bit closer. Okay. Now, I want to talk a little bit more about your future client in relation to the next neck mobilization position. Most of your clients would come with this posture. Yeah. How would you call it? How would you hunchback? Yeah.
Kyphosis.
Kyphosis of the thoracic. Do you see the kyphosis? But also it will come with lordosis of the neck. They will have to do that. Yeah. So one way you want to stretch the neck, you know, think about the neck when you're sitting. So you really want to take the neck and really stretch it really high, isn't it? And by then working also on the thoracic spine to kind of lift it up a little. So we did a traction, but another movement that we can stretch is flexion. Do you remember what flexion of the neck is? Can you do that? Yeah. Okay. So imagine that you have to do something like that. So I'm going to show you 2 variations. Yeah. Actually 3 variations. Okay. Come a bit close to me.
Ingrid.
Go a step
me.
further. Okay. She feels very comfortable right away. Good. Okay. So the first one would be again holding it here. Yeah. Now bend your knee. Bend your knees. No, I'm bending my knees. Yeah. And now bend your knees, and then you're lifting by stretching your knee. Yeah.
We just lift, or at the same time we do pressure.
Right. So at the beginning, just lifting.
Okay.
So like that, and then you're stretching it. Now look at my body. I'm kind of almost like leaning like that. So I don't want you to be there to say, "Oh, I'm scared of what happened," and then you see what happened is like all slip. Take some confidence. By the way, a nice way to put your hand underneath is not right away, but what I'm doing is moving it one way, putting it, moving it the other way, yeah, and then lift it. Once it's lifted, then you can do a little bit of movement, but also, do you see my finger there? Can you come close up to my fingers? Do you see what the finger is doing?
Messaging.
Yeah. Nice mobilization, and maybe a little bit this way or that way, but actually it's more my body does that, but with a lot of flexion. Yeah. So this is the first one. The second one is taking the hand across the shoulder this way. Yeah. So again, how I do that? I move the head one side, go underneath, and putting the hand on the front of the deltoid. And then put the other hand here, and then you just stretch. You don't do it with the elbow, you do it with your body. From here, stretching. And then again, you can play a little bit. This little movement really helps them to relax. And then you're taking it down. Again, move it this way. Put the hand underneath. So you see there is a lot of in-between. And the in-between is equally important because you don't want to rush it. They're not going to let you do it. Then you can do it with the 2 hands, just like that, but I'm not using it as much. And then you can really kind of put the hands. You see the hands here, her head is in between the 2 forearms. And you can kind of moving it. How does it feel?
It's all right.
Yeah, not great. Maybe like that.
Yeah, it's a bit better.
Okay. So I needed to stretch it a little bit more. Okay. So that's the second one. The third one is even more stretching. And what you do, you're bringing, it's a bit of preparation. You're bringing your hand just like that. Yeah, you might need to kneel even. And putting your hands onto the other side. And then bringing your elbows together.
You're bringing her shoulders up.
No.
Shoulders are lifting a bit.
Yeah, well, because I'm lifting, come to the side and see it. Yeah, so I'm actually leaning like that. So again, how does that feel?
That's a much stronger stretch.
Much stronger stretch. So be careful from that when you have clients that not, let's put it in the grade, they're not ideal. You have to do it only with clients that are kind of healthy. So again, you're putting one hand here, one hand there, and then bring it together. Bring your elbows together, and here you cradle the head. No yanking, very soft and slow. You can even do the massage on the scalp in here while moving it. And then slowly bring it down. So 3 different techniques. Start with the just lifting and then put the shoulder, your forearm on the shoulder across the other side and then the 2 hands together.
And they're all good for posture and stuff? No.
Yeah. It would feel like you're stretching the neck a lot. Okay? Shall we give it a try? Talk about contraindication. So this technique, the more advanced technique you do, the better they are, but also you have more risks. Do you see the risk in moving and stretching? Yeah. So which client do you think, what would be the profile of the client that you're thinking, or maybe I'm not going to do this technique on?
Someone with osteoporosis.
Osteoporosis, isn't it?
Elderly. Well,
So,
maybe not.
elderly, well, let's put it this way. You have 2 elderly clients. One is a nice ex-sailor. He's like, okay, what I'm doing? Oh, I'm gardening and I'm visiting my grandchildren. Okay, that's fine. But you see a frail elderly person that not well, and this one is not well, and they're having this hospital and that one. Even if it's in the kidneys and then in the digestive system. Okay, do you see the difference? Yeah? And a lot of the consultation is about general well-being and health. So, yeah, I agree that elderly people, you might need to be aware. And if they are not well, you have to start thinking maybe do it less. Yeah? Who else?
Maybe people with rheumatoid arthritis and ankylosing
Yeah.
spondylitis.
All this nasty stuff. Yeah. Now we don't know much about it. So you know a little bit about rheumatoid arthritis, but rheumatoid arthritis really relaxes the ligaments. So imagine that you do that, and all the ligament in the spine kind of not holding, or let's say any spinal condition that is moderate to severe, you don't touch it. How about slip disc in the neck?
Yeah.
How about tension headache? Would you go? Tension headache means headache that comes from sitting and posture.
Yeah.
Yeah, good. What about shoulder ache?
Yeah.
Yeah.
You do, yeah? What about neck, a kind of moderate pain? Yeah, you can do. What about severe pain in the neck? With no, you don't know what, you leave it. Okay? So sometimes, the client doesn't know what they have, so you have to make an assessment. And the assessment is on the severity of anything that comes. If it's getting to be kind of too severe, doesn't matter what it is, you leave it. If it's reasonable, and how do you know it's reasonable? By assessing how does it affect their life. What can you do? Can you be active? Can you do your general go about? And if you can, then it's fine. And if not, then it's not. Yeah? So assessment, starting, case history, assessment, treatment, all together. Good. Anything else I have to say about it? No, it's really in the power is in your ability to assess. 95% of the client, even more, would be absolutely fine. But some of them, you would say, no, I will avoid it. Okay? And these are very, very important so you can practice safely.